This bio test is killing me. How are we supposed to memorize all of the parts of the male and female reproductive systems?
Tell me about it. I still can't remember the function of epididymis. Where does it even go?
I think it's a storage for sperm or something. Wait, hold on. Yeah, it's a stores and matures sperm.
Right, that actually makes sense. But honestly, all this reproductive stuff got me thinking something about kind of serious.
What?
So, you know how early teenage sexual relationships can lead to real consequences? I heard that a girl in another school got STI, and one of the interesting things, she didn't even know it for weeks. And STIs is one of the biggest biological consequences, especially when teenagers aren't using the protection properly.
Yeah, I think we should include that in our test prep. We might even get a question about the real-life application of this reproductive knowledge, like something like how can we treat STIs or anything.
Yeah, good idea. Let's pick 4 STIs and how actually they work and what can be done after someone gets infected. Prevention is great, but we need to know about treatment too.
B. In 2015, about 1.1 billion people were reported to have STDs. Other than HIV/AIDS, this resulted in about 108,000 deaths. About 500 million were infected with either syphilis, gonorrhea, chlamydia, or trichomoniasis. An additional 530 people had genital herpes, and about 290 million women had
Bacterial STIs include gonorrhea, syphilis, and chlamydia. Statistically, half of the STDs occur in people between the ages of 15 and 24.
So the first one I choose is one of the most popular ones, chlamydia. It's caused by a bacteria, right?
Yeah, chlamydia trachomatis. It also often has no symptoms, especially in girls. Also can cause infertility if it's untreated.
Major risk factors include unprotected sex, multiple sexual partners, being under 25 years old, and previous STIs. The life cycle of chlamydia involves 2 stages: elementary body, infectious but non-replicating form that enters host cells, and reticulate body. It replicates inside cells, then transforms back into EB to infect new cells. The symptoms in males is painful urination, discharge from the penis, and testicular pain. In females, it's vaginal discharge, pain during sex, and pelvic pain, or no symptoms at all. This shows how screening is important.
Next, I think gonorrhea is a widespread sexually transmitted illness. It's also bacterial and it's caused by Neisseria gonorrhea. If it spreads, it can affect the joints and even heart valves.
Globally, an estimated 78 million cases of gonorrhea are diagnosed each year. In 2015, it caused about 700 deaths. Gonorrhea is most commonly spread during sexual contact with an infected person. However, it can also be spread from mother to child during birth.
Then, syphilis. It's kind of scary because it happens in a few stages, and the last stage can also damage your brain.
Syphilis is transmitted through sexual contact from mother to baby during birth. After infection, it progresses in stages. Primary, 3 to 6 weeks, a painless sore or chancre appears at the site of infection. Secondary, weeks to months, skin rashes, fevers, and swollen lymph nodes. Latent to years, no symptoms, but the bacteria stay in the body. And the last one is tertiary, years to decades, severe damage to organs, including gummas, heart disease, and neurosyphilis, affecting the brain and the nerves.
And the last one, trichomoniasis. That one's caused by a parasite, right? Trichomonas vaginalis. Most of people don't even know they have it. That's absurd.
After exposure, the incubation period lasts 4 to 28 days. The parasite attaches to the genital lining and multiplies, causing inflammation. About 50% of infected females and most males show no symptoms. When symptoms do appear, they may include vaginal discharge, itching, or painful urination. If untreated, it can lead to infertility, pelvic inflammatory disease, and pregnancy complications like preterm birth. So, what happens happens if someone gets one of these? Let's discuss 3 biological solutions.
Okay, the first solution I think can be a targeted antibiotic or antivirus treatment. This one's super effective for bacterial infections like gonorrhea or chlamydia. Doctors mostly use azithromycin or doxycycline.
STIs like herpes, they use acyclovir and valacyclovir. These don't cure, but they reduce the outbreaks and symptoms. And there are new therapeutic vaccines in progress for herpes and even HIV. They're trying to boost immune response through T cells.
I think as a first solution, we can take restoring the microbiome, like using probiotics to bring back good bacteria in the vaginal area, especially after an infection.
That's interesting actually, because healthy bacteria help maintain a low pH, and that actually kills or blocks STI passages. I think the first one is the most realistic for treating infections after they happen.
Yeah, because it directly attacks the bacteria or virus. Like doxycycline stops bacterial protein production and antivirals stop virus from replicating.
Also, it's available in most hospitals or clinics. It's fast, specific, and works if the person is diagnosed early.
But there are disadvantages too, like what if people don't know that they're infected? Then the bacteria spreads. Antibiotic resistance is becoming a serious issue.
That's true. Plus, some people can afford antiviral treatment. Even though it sounds specific, it's not always accessible.
Also think about the social factor. Like how does society affect treatments?
So, there are advantages too. Firstly, now more people are more aware of STI treatment from social media. Secondly, clinics in urban areas often provide free, low-cost treatments. Thirdly, schools are starting to include STI education, which reduces stigma.
And lastly, social stigma still makes people hide symptoms until it's too late.
Yeah, so even the best solution won't work if people feel too embarrassed to get treatment.
So to wrap things up, early teenage sexual relationship can lead to dangerous sexually transmitted infections. And even though we have biological solutions, it depends on how informed and supported the person is. Okay, now back to the test. Wait, what is the function of corpus luteum again?
No, not again!